Hello viewers. Today's topic for discussion is dry eye. Dry eye, one of the most common diseases that humans face today. In other words, we can say that dry eye is the biggest pandemic what the human race has seen in centuries. We do not realize that this is a serious problem because initially the symptoms are very mild and we are not aware of this disease. Now we'll see how and where the tears are formed and how they are excreted out of the eye and why there is dry eye in some patients. So here we see on the outer corner of the upper eyelid, inside the eyelid, there is this structure which is the tear gland. Most of us who are not doctors are not aware that we do have some gland like this inside our upper lid. So this is the tear gland. Then there are tear gland ducts. So this would make tears which contains water, mucin, oily layer, certain vitamins, minerals, antibodies, all those things. So it's a mixture of, it's a complex compound. So these are secreted into the eyes. Then it covers the eyes, keeps it moist and comfortable. Then there are glands in the eyelashes roots, which are glands of Zeiss. They also contribute to the tear film and secrete oils. So this helps the tear film to stay for longer hours. And then inside the eyelids there are glands of mole. So these glands also secrete oily layer, and so that the tears can stay for longer time. Then whatever is the requirement of the eye sticks to the eye, and the excess tears are drained through. There are two small openings in the upper and lower eyelids which are called punctum. Then there are canaliculi, upper and lower, and then they drain into nasolacrimal sac, and this is nasolacrimal duct, and then the excess water goes into the nose. So this is how the whole process of tear forming and its distribution occurs. And the main reason behind this pandemic of dry eye is that now most of us are using screens in form of mobile phones, computers, tab, laptop, and once we exceed 2 to 3 hours of viewing time, then we are likely to develop dry eye syndrome. Then there are those traditional reasons behind dry eye where aging can cause dry eye because with the age the tear production decreases, and then people who are working in hot environment, like people working in factories near furnaces, and when the profession requires people to remain outdoor for long hours, in all those cases we get dry eyes. Then vitamin A deficiency is the main reason for dry eye in small children. Now we'll be discussing those eye diseases where dryness is one of the symptom or sign, and these diseases are usually related to the eyelid diseases. One of the commonest disease is blepharitis. Blepharitis we say when we get inflammation in the margins of the lids. In all these cases, the glands which secrete oil for our tear film, the meibomian glands, the glands of Zeiss, they get inflamed and affected, and they reduce their oil secretions, and hence we get dry eye. Then there are lid diseases like ectropion. Ectropion is when the eyelids get inverted outside. So as you can see in the picture, this is ectropion which causes dry eye. Then the other disease, which is entropion, where the eyelid moves inwards. So in these cases again we get dry eye problem in patients. Then one of the commonest eye disease which can cause dryness is allergic conjunctivitis. So most of the patients with allergic conjunctivitis also have dry eye in them. Then there are other diseases like all other diseases of the eye where the blinking rate is reduced, including computer users. So reduced blinking rate also causes dry eye. And of course, vitamin A deficiency, it causes beta spots and other things along with dry eye. So other important reasons which cause dry eye include certain general diseases which occur in other parts of the bodies, but they cause dry eye. These include certain autoimmune diseases like Sjogren's syndrome, where you have dry skin, bony deformities and dry eye. Then rheumatoid arthritis. All these patients with rheumatoid arthritis, most of them would face dry eye also. Then thyroid disease can cause dryness in the eye, and another disease is sarcoidosis. That is also an autoimmune disease which causes dry eye as one of its symptoms. So not only diseases, but certain medicines also cause dry eye, and prominent among them are antihistaminics. So whenever we take antihistaminics for any allergy problem for our eye, and or say for common cold, we do get dry eye as a side effect from these medicines. Then there are certain antidepressants which can cause dry eye in patients who are taking it regularly, and of course blood pressure patients or heart patients who take beta blockers, they also experience dry eye in their eyes. Then one lifestyle change, like people who use contact lenses, if they use it for longer duration every day and for months or years together, then they are also likely to get dry eye in their eyes. So they should be very careful about using contact lenses regularly. Now we'll discuss what are the symptoms of dry eye. Most of the dry eye patients would feel real dry feeling in their eye, and it can lead to itching, irritation, foreign body sensation, grittiness in their eyes. Paradoxically, some of the patients would come to us with a complaint of watering, and once we tell them that they are suffering from dry eye, they really don't believe at first instance, because they think their eyes are watering and my doctor is saying that you have dry eye. But this is a fact. Most of the dry eye patients would have watering in their eye. So why do we call it dry eye then? Because tears, when formed properly and when they enter eye, they nourish our eye and they stay there for a long time to keep our eyes moistened. But in dry eye, what we get is our tear glands are reflexly, in response to dry eye, they are producing water. So it's basically watery eye. And this water is not good enough to keep our eyes wet for long duration, and it doesn't stay in our eye for long. And hence it is dry eye, because this watering is in response to the dry eye condition. And of course there is redness, itching, irritation, all those symptoms in the patients. Now how do we diagnose dry eye? Dry eye, by experience, once a patient tells us about their symptoms, and then we inquire about their screen time, and then we examine them on the slit lamp, we come to know that the patient is suffering from dry eye. But just to quantify it, we have a very simple test which is done with the help of this strip. As you can see, this is a very simple strip. This is sterile strip packed, and it has a scale on it. With this scale, you can see there are markings of millimeters. So we just bend this and put it in the eye for 5 minutes in a relatively dark room without fan, and ask patient to either don't blink or blink minimally. And then after 5 minutes, we assess how much is the wetness on the strip. The normal values are from 15 to 20 millimeters. If it is less than that, then we know that it's dryness. And if it is less than 10 millimeters, it is moderate dryness. And if it is less than 5 millimeters, it's severe dryness. So this is how easily one can diagnose dry eye. And finally, guys, the moment you are waiting for, what do we do for our dry eye? Of course, we can do some preventive things, and then we can do some medications also to treat, cure, and control our dry eye. So first thing is, because the commonest reason is screen time, increased screen time for most of us. So we should think about reducing some of the screen time if possible. And then if it is not possible, then at least giving a break in between. Because there's a rule called 20-20-20, where after every 20 minutes of screen time, if you look at an object which is about 20 feet away for 20 seconds, just 20 seconds, then it relieves your eye of the strain which has been caused by 20 minutes of screen time. So this can do a lot of good to your eyes if you are a regular computer or mobile screen user. Then of course, in kids, when the primary reason for dry eye is vitamin A deficiency, their dry eye will be relieved only by taking vitamin A orally or through injections. Then there are diseases where it is dry eye and less tears are being formed, like autoimmune diseases and other, where we would need, in fact, most of the dry eye patients would need lubricant eye drops. And in lubricant eye drops, in last 20 years, there has been a lot of progress, and we have very good salts with us which can control dry eye very well for longer durations. Initially, there was basic salt HPMC, which was later replaced by CMC, carboxymethyl cellulose. So now this medicine, CMC, is available as 0.5% and 1% eye drops, and is very good for dry eyes. Then we have a second group of medicines which are called polyethyl glycol or polypropyl glycol. So this combination is also a very good lubricant for our eyes, which we can use without any harm. Latest addition to this is medicine which is way better than most of these medicines, which is sodium hyaluronate. This has the advantage of maintaining our tear film for longer duration. It prevents evaporation of the tear film from our eyes and keeps them moist for quite long durations. So most of us in this era where we use screens would need tear substitutes for longer duration, maybe throughout our life, if we have to take care of our dry eye symptoms. So friends, do take care of your eyes by preventing dry eye to whatever extent we can by changing our lifestyle or screen time. But if need be, then we must use tear substitutes.